Hi, this is Just Be Well, the channel about whole life living. We're talking about chronic fatigue, chronic unrelenting, life altering fatigue. We're talking about brain fog and roving joint pains, muscle pains, and mood swings. These are all symptoms of chronic Lyme disease. There are other causes as well, and we're talking about all of it because we're talking about the symptoms today.
hmm
I'm Tom Sult, a medical doctor and functional medicine provider.
I'm Elizabeth, a registered nurse and whole life coach.
So here we are. What is this stuff we're talking about?
Today, really, we're talking about the symptoms that are associated with chronic Lyme disease. So, we really wanted to concentrate on the symptoms because not everyone is aware of, or has heard of, or believes in the term chronic Lyme disease.
Yeah.
So, we really wanted just to remove or kind of eliminate that word for the day and really just discuss the symptoms that we see in our patients, these reoccurring symptoms that affect their day-to-day lives. And even if we don't give it a name or look at it in its entirety, we can really look at these symptoms individually and give you ways that you can help to manage these symptoms so you can live a normal life.
Yeah, so fatigue. I think all of us have experienced fatigue at one time or another, but
Mm-hmm.
Lyme disease is really, I like to say, unrelenting, life altering fatigue. The
Mm-hmm.
kind of fatigue where just getting out of bed is more work than you really planned on for the day.
Yeah, the kind of fatigue, where if you've had, like, let's say I like to look at Thanksgiving meal, and after you've indulged in all that food and turkey, kind of that just feeling afterwards where you can't really think and you need a nap, that type of fatigue.
Yeah, so that's one of the common symptoms, and probably almost mandatory symptom for Lyme, chronic Lyme.
Mm-hmm.
But then a very odd symptom that's fairly unique, not absolutely unique, but fairly unique to Lyme is roving pains, whether they're joint pains or
Mm-hmm.
muscle pains. And I don't know, did you ever experience that?
Mm-hmm. I did. And I always, I just came to know that as it was just a weird symptom that I had. But one day I would wake up and I would have pain, like for no reason, in my right elbow. And then the next day, for some reason, it would be in my right hip
And
or
your right
maybe
elbow would be
my
better.
knee. Yep. And just like that, it would be like that was completely better. And, it's not like I could really associate it with a specific type of injury or something I was doing that would have caused it. Now, of course, you can always try to find things that may attribute to it, but yep, just how it would move around, or I would always be like, oh, my back would hurt. I'd have these tense muscle spasms in my neck or in my lower back or
Yeah, and the unique thing, really, if you had an orthopedic injury to your elbow, it wouldn't be so intense you can hardly use your arm,
mm-hmm.
and then 2 days later
completely
gone.
gone. Like
So
nothing happened.
yeah, so there's something different happening here.
Mm-hmm.
It's not a sprain or a strain. It's probably not even Lyme disease arthritis. It's probably more likely, in my mind, more likely some kind of neurological pain that's happening in that joint or muscle. And they rove around. And
Mm-hmm.
it's just so odd that it goes from so bad I can't walk on that knee to, oh, that knee's fine, but now my
Mm-hmm.
shoulder hurts so bad I can't stand it.
Yeah, or my
That's,
feet.
yep, very strange, fairly unique symptom to Lyme. And then brain
Mm-hmm.
fog. What on earth is brain
A
fog?
symptom I had never heard of such of a thing actually as brain fog until I experienced it. And brain fog is just like that. You feel like you're almost swimming around in pea soup. Like um, you know,
Sounds unpleasant.
yeah, just the day everything has it's almost like it's fuzzy, like it's not in focus. I mean, your sight is fine, but you can't really focus on things or process things. Like if you're reading something or somebody's saying something to you, you're hearing everything that they're saying or that you're reading, but you're unable to process like exactly what they're saying or the meaning behind it. It's really strange. It's a strange symptom that's really hard to even articulate into words. Like as I'm trying to explain it now, it's hard for me to even.
I have had many patients, even patients who are like engineers, or mechanics, people who are, very accustomed to doing manual things, and they will say, some days my brain is so foggy, I look at a light switch and I'm not entirely sure what to do with it. I mean, that's brain fog. That's bad, right?
Yeah.
But that's how bad it can be. I mean, but more commonly, people will say, I do stuff all day at work, just stuff I always do. And now I can't quite remember how to do it. Those kinds of things, that normal routine things, they just can't quite pull it up and make it happen. And that, of course, is devastating, and it makes it hard to keep your job and all kinds of terrible things. So this brain fog issue, and it's not dementia. You're not going crazy. You are not getting Alzheimer's disease. This is a completely separate thing, and it's treatable. Lyme disease is treatable. So this brain fog thing, big deal. And then mood instability. What is that all about?
Just these mood swings that you don't, between your overall mood, or it might just be anxiety. Like you're anxious about everything and you're not quite sure why. And then with the anxiety comes also feelings of, for a lot of people, depression. And, granted, you can become depressed just because you've been ill for so long, but for me, these symptoms came about even though even to the point before I was ill, I was starting to struggle with the anxiety and the mood swings. I felt like my hormones must be messed up. Like there's something going on with my hormones. And then also just the depression. And with the depression, I also linked in like the fatigue, and it's difficult to get out of bed in the morning as well.
Yeah. So lots of really debilitating symptoms commonly associated with Lyme. What do you, like, from a diet and lifestyle point of view, home remedies? What helped you with some of these symptoms even before you were diagnosed with Lyme and started actual formal Lyme treatment?
Really just overall healthy living. I noticed a significant improvement in my symptoms during the time I was especially pregnant. And I attribute
That's common.
And I attribute that because I stopped drinking any and all alcohol, of course, and I really watched my diet for really everything, because then it takes, for me, it's easier to take myself out of the equation. You're more likely to do something for somebody else than you are for yourself. And being pregnant was one of those things. I could take great care of my body when I was pregnant because I knew there was another human being inside of me that I was responsible for.
Probably the closest I've ever come to being assassinated by a patient was when I jokingly suggested to a woman that because she was so much better when she was pregnant, maybe she should just stay pregnant all the time. She didn't think that was hilarious at all. I thought it was kind of funny, but not her.
Yeah.
So, you don't think it's funny either, do you?
I was definitely pregnant often for quite a few years.
Yeah, you were.
So just the overall, I think, eliminating alcohol, eliminating those toxins, because I was really watchful of any sort of toxins that I was being exposed to, and then incorporating a healthy diet. Around that time is when I really got into the 5 ingredients or less. I wouldn't eat anything or put anything in my body if it had more than 5 ingredients in it, or if, of course, if it was a whole food, it's 1 ingredient, but anything that had more than 5 ingredients, I just wouldn't eat it.
So if you think about, you've got a glass and it's filled to the brim, and that's the Lyme disease. And then if you just drip any little bit of toxin on top of that, whether it's, just about all food that isn't organic contains pesticides and all kinds of stuff, it overflows the glass, right? So the idea of this diet is clean everything that you have control over up as much as possible, right? And then hopefully you get just a little distance between the rim of that glass and your Lyme symptoms so that you can tolerate a little bit more. But almost everyone with chronic Lyme, it turns out, has some kind of what we call antecedents. It's a predisposing factor. Often they have what are called SNPs, single nucleotide polymorphisms, that are genetic variations in their ability to detoxify, or their inflammation pathways that makes them more pro-inflammatory, or in hormone pathways or whatever. So cleaning up your diet makes the stress on those various pathways lower so that it can accommodate the Lyme better. And then, of course, you need to get diagnosed and get on appropriate treatment. And we've talked about that in quite a lot of detail. So those are the common symptoms of Lyme. And the big issue is, I think, sleep. Sleep. You got to sleep. And if you can't sleep, you got to find a way to get sleep. Many people with chronic Lyme find it extremely difficult to sleep. If you go to our website, you'll find into the store and click on sleep, you'll find a bunch of things to help with sleep. Go to your doctor, get some help with sleep. Go to your naturopath, wherever you need to go, but sleep. Figure out how to sleep. And then movement and exercise. We've done a whole deal on that, and we talked about sub-symptomatic threshold exercise. In other words, if you know that if you do this much activity in a day, you're going to crash and burn because of your Lyme, susceptibilities, only do 50 to 80% of that amount. If you're really sick, 50%. If you're not as sick, 80%. But the idea is movement helps your immune system, and a little bit helps some. So getting some movement is important. And then nutrition, we alluded to a lot. Trying to eat organic so that you're not getting glyphosates and other toxins. Trying to avoid toxic personal hygiene products and so on. Stress management. Stress turns your immune system down. It's like a dimmer switch, just turns it way down. So that's important. And then relationships. For many of us, relationships can be our most supportive thing in our lives, and they can also be the most stressful things in our lives. So managing your relationships. So those are really the 5 modifiable lifestyle factors, and really important if you're suffering from these Lyme symptoms. Another spot you might want to look to go into this deeper, our website, if you go to our website, justbewell.info, and slide across to healing programs, and then down to rebalance to heal, you'll find 5 or 6 pages of information about this whole topic. You want to introduce your new buddy?
I have something on my lap. She's sleeping right now, but...
Oh, is she?
Yeah.
Finally,
okay.
She's been squirming like a...
This is Sage.
This is Sage.
She is our new family member.
Well, I think, did you already share that picture?
I didn't. I'll share a picture.
I have 2
earlier
Newfoundlands.
Today. We were working and we had 3 office
dogs, 2 Newfoundlands, which are, basically 150 pounds each, and her all laying next to. It was pretty funny.
Yeah.
So that's the Lyme endeavor. We have a Lyme program. It's basically a year's worth of program, a year-long program. It's the value of it, if you add everything up, is like $24,000 worth of care for under $3,000. And we'll put a link to that page. So if you want to look deeper into how we treat Lyme, and
right, and maybe you haven't been diagnosed with Lyme.
Yep.
We were talking about this earlier today. That's why we decided to bring up this subject today. But maybe you have fatigue. Maybe you have that joint pain we talked about, that muscle pain that moves around, brain fog, anxiety, or depression. Maybe you have a collection of weird symptoms
that have not been diagnosed yet because they're too weird.
Yeah,
it's probably Lyme.
This group would also be
good for you.
Very helpful.
Because we can figure it out. If it is Lyme, great, and we'll run with it. And if it isn't, we'll still help you with those symptoms.
Right.
Because we use a functional medicine approach, which really treats things upstream rather than waiting until you're going off the waterfall. We try to get you when you're falling into the creek upstream.
Right. We don't treat the disease itself. We treat you to the point where the disease can't flourish any longer.
Yep.
So it's really
And then and then if it is Lyme disease, on top of that, we treat the bugs also.
Right.
Yeah.
Yeah.
All right. So short and sweet today. We have a couple of people watching. Any questions? We'd be happy to entertain them. We've been talking about the major symptoms of Lyme disease and how to treat those at home with diet and lifestyle. And we've been talking about our own program that we'll leave a link to in the comments. All right. Not seeing any people brave enough to ask questions. So we will see you later on. Bye.
Bye.